Guys, welcome to the webinar this evening, Reversing Neuropathy Naturally, how to stop it in its tracks. If you are here for the neuropathy webinar, you're in the right place. Eastern time here, we're about a minute or two before the hour. So we're gonna let a few more people get on. Our last webinar, I believe we had just about 100 people on with us a few weeks ago. And I think we're due to have a few more than that tonight. So I'm going to let the rest of the folks get on here tonight. So if you're here for the neuropathy webinar, you're in the right place. What I always like to do, guys, as we're getting started, is I'd love to know where you guys are listening from. So if you see the chat box in the bottom of your screen, there should be a little box that says chat box. Go ahead and click in there and tell me where you're listening from. I'm from southeastern Pennsylvania myself, about an hour outside of Philadelphia. That's where I grew up. That's where we live now, my family and I. And so let me know where you guys are listening from here tonight. Venezuela in the house. Very good. Very good. Well, welcome. Karen, okay. Kennett Square. That's just down the road. Florida, Arkansas. Great, guys. Well, welcome. Let me know where the rest of you guys are from. Okay, and we have a few more people getting on. We're right at 7 now, so we're going to get started in just a minute. I'm excited to share with you guys tonight. This is one of my favorite things to do. Okay, I see a quick question I'm going to answer here. Trigeminal neuralgia, that's a little bit of a different animal. We do help people with that, but that is more of a chiropractic issue with the cranial nerves that come out from the base of the skull. We've helped people who were suicidal with trigeminal neuralgia, literally years, have that go away. It doesn't always happen like that, but we've seen it. So from Virginia, I don't see your first name there. Go ahead and send me an email and I can get you hooked up with that. Some of the neuropathy protocol we do may help with it, but chiropractic is the best thing that you can do. Okay. Madhu, if I'm saying that correctly, send me an email. I'm going to put it in here. I'm going to type it in right now before we start, just because I know how severe trigeminal neuralgia can be. Let's do that. So Dr. Dan at drmcclyman.com. Send me an email. I'll help you out. Okay. All right. Arizona. Hey, Doug, welcome. Okay, guys. Very good. Very good. So listen, we're going to get started. I'm going to share my screen here in just a moment. Reversing Neuropathy Naturally. I'm Dr. Dan McClyman. It's drmcclyman.com. This is one of my favorite things to do. We are blessed to help thousands of people with neuropathy. The industry lie is that you can't reverse it. And that would be a true statement if you are coming at it from the traditional medical approach. You're not going to take enough drugs to reverse neuropathy, not enough injections or surgeries. That's not going to do it. However, if we can work with your body's ability to heal, and we catch it soon enough, we see it reverse all the time. We have a 97+% success rate with it. I'm going to share that with you. Okay. So a few more people are jumping on here, guys. If you haven't, let me know where you're from. Let me know where you're listening from. Okay, here we go. I'm going to share my screen and we're going to get right into it, guys. Okay, very good. I wanted to thank you all for taking the time tonight to be on this webinar. If you're on this webinar, either you or a family member is suffering from neuropathy or a loved one, and I take this very seriously. I want you to know that I respect your time, and I'm going to do everything that I can within my power over the next 30 to 40 minutes or so to truly change your life if you'll let it. So I'm going to provide the best information in the most concise fashion that I can to allow you to change your life, to stop going down this path of degenerative neuropathy, nip it early in the bud if you can catch it early, depending on where you are, and start going the other way with it. Because I know, and part of why we do this is because I know that when we don't handle neuropathy correctly, I know what it means for people. It robs them of their quality of life, their retirement, time with their family, loved ones, grandkids, kids, great grandkids, traveling, gardening. There's a lot of things. So we're going to get into that. Okay. But I want you to know that I'm excited to share with you tonight. So on that note, these guys right here, the phones, other windows on your computer browser, put those things away, close them down. Let's take the next 30 to 40 minutes or so here and let's focus. Let's dive in. You've reserved the time. Let's do this together. I want you guys to know as well, just a brief idea of what you can expect here. If you don't know what to do, if you've heard, which most of you probably have multiple times, that you cannot reverse neuropathy, that's not a good enough answer for you. That you want to discover how to do this naturally, how to get to the cause. You know that when you cut your finger, God forbid, you put a Band-Aid on it, the Band-Aid doesn't heal your finger, your body does. You know that that's the truth. When you break a bone, God forbid, the cast doesn't heal the broken bone, your body heals the broken bone. You know that your body is capable of far greater healing than anyone's ever led you to believe. That's almost always the case. So if you know that's the truth, then you're in the right place. I'm going to cover 3 of the biggest mistakes, the pitfalls that people have with their neuropathy. Stay to the end of this call, and I have a special bonus for you. I said that I was going to provide information on this call. That's part of what I'm going to do. But the best information in the world without action means nothing. It doesn't get anything done. So procrastination is the thief of health. And I want to get you out of awareness and into action. So I'm going to show you what you can do. If you don't have my book yet, we can get you a copy of my book sent as well. So make sure that you stay to the end of the call. We already covered this. Get rid of the distractions. So I want to jump right into this, guys. You know, a little bit about myself so you know where I'm coming from. This is a dated picture. I need to update it because on Valentine's Day of this year, we had our 3rd little boy. This is my beautiful wife, Megan, Dr. Megan. She's a doctor as well. And then Jack and Brooks. And then our little guy right now is Everett. He's the newest boy. We have 3 boys. I love my family so much, as you all do as well. That's one of the biggest anchors that I operate on with drmcclyman.com, connecting generations. One of the things that I talk a lot about, guys, this is a school project right here from 6th grade. It's a book project that we did. It's called My Grandmom and Me. This is my grandmom, Rosemary, Italian and Polish on that side of the family, my mom's side. Connecting generations. I was very blessed to grow up with 3 out of my 4 grandparents. My dad's dad, my pop, he died before I was born at 57 years old. He was in the Battle of the Bulge in World War II. And I'm grateful for what I know about him and what I've learned and work ethic from my dad, one of his sons. My other 3 grandparents I got to grow up with for a number of years. My grandmom, Rosemary, that I just showed you there, she passed when I was 10 years old. When I was in 6th grade at 70 years old. She went into the hospital. They were trying to figure some things out, discharged her, went back in, got sepsis, an infection, never came out of the hospital. So, you know, I tell you that not because she had neuropathy, but because I have a tremendous value for family and connecting generations so that grandchildren can grow up with their grandparents. You can share those experiences together. And like I mentioned before, if we don't handle neuropathy correctly, that doesn't happen like it otherwise would. So anyhow, I want you to know a little bit about where I'm coming from. We do a lot with neuropathy. My professional training is that I'm a neurologically based chiropractor. I'm board certified in neuropathy care. We specialize in a home model of care. So I'll get into that, but no matter if you live in Texas or Oregon or Pennsylvania or Ohio, we help people across the country with their neuropathy. And if you live 5 minutes down the road, I know somebody on here this evening was about a half hour from where we physically are. No matter if you're 5 minutes down the road or if you're across the country, we do the same home care protocol, because neuropathy, as you'll see as we get into this, it's a train of momentum, a degenerative momentum that we need to slow down, stop, and reverse. Why I say that is because it doesn't require once or twice a week care, like if you were going to someone's office in the beginning. It requires once or twice a day care, half-hour sessions, home protocols, nutrients, those sorts of things. That's a little bit of a jump ahead to why we have such a high success rate. Anyhow, my little fella's here. This is Everett on the left side of the screen there. He's 4 months now. And then Jack and Brooks, and they make the funniest faces. So anyway, I just wanted to let you guys see a little bit about my family. So if you have a desire to get to the root cause of the issue, that's what we're going to do. It's not me who's going to heal you. It's not my team, as amazing as they are. It's not the protocols or the nutrients that we do. It is your body that's going to do the healing. We are going to work to create the most appropriate environment for your body to heal as efficiently as it can. That's what happens. But make no mistake, it's not because of me. It's actually in spite of me that your body is able to heal. I don't put my faith on other people, but I'm also not shy about it. I believe that we were actually designed perfectly. I don't believe that God makes mistakes, and I believe that our bodies were designed to heal. I know that that's the fact. It's a biblical truth, and it's a scientific fact that our bodies are self-healing, self-regulating organisms. Body's made to heal. Body's a miraculous, perfect design. So knowing that that's the case, neuropathy, you can't reverse it. Do your best to live with it. Here, take this gabapentin and Cymbalta the rest of your life, and you'll probably wind up in a wheelchair and perhaps amputation. That's not good enough. It's not a message of hope. It's not a message of truth. And so that's why on a Tuesday night here, I am doing this webinar with you all, because I want you to know truth when it comes to this, okay? 5 things: the traditional approach and the challenges, the major causes of neuropathy, the dangers and the reality of this condition, the methods that we utilize for north of a 97% success rate, and then the simple steps, the practical steps that you need to take to get this going in the right direction. That's really where we need to get to, because, I can tell you a bunch of stuff, but if we don't do anything with it, it's not going to matter. Okay. So I covered these things. We have a local practice here. We're blessed to have a large team. We just hired 3 more doctors. We're in the process of hiring more. I'm grateful that God's given us this vehicle to help people physically in our local area with our brick and mortar location. We're getting ready to start a second location, and our virtual practice as well, to help people far and wide. That's my prayer, is that the Lord will increase and expand and multiply the impact that he's making through us. So that's a little bit about what we're up to. Okay. So let's dive into some of this content. Who do I work with all the time? Neuropathy. Some of the things that you see listed here: balance issues, trouble walking on soft or uneven surfaces, trouble sleeping, difficulty wearing closed-toed shoes or walking in general. You can't have the sheets touch your feet because they're so sensitive. Burning, freezing, tingling, pins and needles, swelling, discoloration, trouble walking. You're able to walk, but maybe not as quickly as you used to. Shuffling, fall risk. The steps are more difficult. Can't feel the gas in the brake pedal as well as you used to. Here's the thing. They're the physical things, but as well as I do that they have mental and emotional repercussions. And I'm not shying away. I don't shy away from talking about that, because that's the reality. Those things often lead to frustration, depression, anxiety, worry, embarrassment. We go on family vacation and I feel like I can't keep up with the group. I'm holding everyone back. It's a frustrating and embarrassing situation. It's, you know, something that can keep people apart because you don't want to hold the rest of the group back. You don't want to be a burden to your spouse, to the rest of your family. You know, these are the kind of things, and I don't say that to be dramatic. I say that because these are the kind of things that come up when I'm working with people, you know, suicidal tendencies and thoughts because of the decline in this condition. So again, you know, if I have one chance to help you, I'm not going to water down this message. You know, it's much greater than a physical issue. Okay. Let's talk about a couple of these things briefly before we shift gears and move on. Independence, being able to stay in your home and not move to a rancher or an assisted living facility. People love, oftentimes when I'm working with people, you know, to garden, to work in their yard, you know, be outdoors, grandchildren or great grandchildren, sporting events, you know, maybe up and down the bleachers. You know, they're traveling, they're walking, hiking, walking the dog, bicycle riding, you know, swimming and those kind of things around the pool, up and down the ladder, getting out of the pool, in the pool, riding the motorcycle, working on cars, driving cars, standing for longer than 3 or 4 minutes at a time, you know, cooking, entertaining, you know, independence, the ability to do the things that you want to do. What my finding is that people typically bust their butt their whole life, to say it lightly and nicely. And then they have more time on their hands. And if we don't have this neuropathy situation handled correctly, then they're typically not able to do the things that they've dreamt about their whole life or most of their life. A lot of times there's more time, there's maybe some money aside to, again, you know, be able to do some of these things, and we're not able to because of neuropathy. That's what we're talking about tonight. I have a lady, her name's Mary. Her videos are on, you know, 2 or 3 of our websites and YouTube channels and things like that. But Mary's 86. About, what is it, June, almost July. So about 5-6 months ago, she started her care. She could only walk for about a minute or 2 at a time. She was not able to garden. She said, you know, I'm ready for the Lord to take me whenever he's ready, you know, but I'm obviously still here for a reason, you know, but I don't know what to do with this condition. You know, I don't want to take the gabapentin. I don't want to, you know, continue to have more injections and pain management. You know, it's not fixing anything. And she says 3.5 months later, in April, a couple months ago, from when we're doing this webinar this evening, 3.5 months into her care, she says, when I do her first reassessment, she says, in more or less words, she's ecstatic. She says, I'm able to walk 45 minutes at a time from a minute or 2, just 3.5 months earlier, 45 minutes at a time. She says, I was out in my garden last night just for hours and hours until it got dark. 86 years old. So, you know, I work with people in, you know, their 40s and their 50s. Sometimes I work with people in their 90s, a lot of times, and I work with people in the middle a lot of times. You know, so the ages can range. So, you know, we'll get into some of this, but, you know, well, mine's too far gone. I've had it for, you know, 12 years, 21 years, 17 years. I've seen it. I've had people in wheelchairs get out of wheelchairs with a home nurse aide in a wheelchair, get out of a wheelchair, use a walker, stop using the walker, start using a cane, and then barely even need the cane anymore. Have his home nurse aide say that I barely need to help him with many of the things that I used to need to help him with. Okay. You know, in his mid 80s. Okay. You know, so we've seen a lot of these things. So I want you to take a moment, and just imagine for a moment, you now have 60, 70, 80 or more percent improvement with your sensation in your feet, in your legs. Perhaps it's in your hands. Your symptoms are dramatically improved. Maybe they're completely gone. Maybe they're still there, but they're much better. And for the first time in months or years, you have clarity and hope that you're now moving in the right direction versus this is continuing to get worse. What am I going to do? You see, that's a big difference. You're able to sleep, pain, burning, pins and needles, electric shocks are gone or greatly improved, more confident in your walking, your balance, more certainty with your steps, able to walk for longer, more freedom and independence for being able to do the things that you love to do without being held back. The confidence that you're going to be able to stay in the home that you're living in and not have to move on account of your neuropathy getting worse. Imagine what that's like for you. Okay, so now let's dive into what we need to do. So just so you know, this can be a very simple process. The approach is simple. There are complicated things, confusing things to confound the wise. There's simple things to confound the wise. This doesn't need to be a complicated matter. I want you to know the necessary steps to move this forward. And I want to draw a quick analogy. We were out watering the garden earlier today. We haven't had much rain here lately. And, I'm thinking about the corn, the squash, the beans, the carrots, the sunflowers. Those plants, they're like your peripheral nerves. They need water. They need nutrients in the soil. They need sunlight. They need this right environment to thrive and to grow. So neuropathy, as you know, there's a restriction to the blood flow, not the main blood vessels typically, going down your legs to your feet, going down your arms to your hands. Typically, it's not the main blood vessels. It's the tiny networks of blood vessels, the networks of blood vessels around the nerves in your hands and your feet, where the blood flow is restricted due to a number of reasons. And then what happens is that the blood flow is restricted, the oxygen supply is restricted right along with that, the blood supply, the oxygen supply. And then those nerve tissues are breaking down faster than the body can rebuild them and repair them. Okay, so gabapentin's not going to fix that. Maybe it helps to take the edge off of the symptoms. Maybe it doesn't. Even if it does, the root cause is still getting worse. Okay. Every medication has side effects, drowsiness, brain fog, fatigue. There's all kind of side effects. Gabapentin, Lyrica, Neurontin, those things are actually anti-seizure medications. Again, so most of you on this call, if not all of you, feel that same way that, hey, listen, that's not the answer for me. That's not good enough. Don't want this to keep getting worse. Okay. So we're about 20 minutes into this call, right? So now we're going to shift gears into the problem and the solution. So mistake number one, I can just live with it. Okay. It's been good enough. I can deal with it. I'm not really interfering with my life at this point until it does. It's like a hockey stick usually, where it gradually increases, sometimes for months, sometimes for years. And then in a matter of weeks, boom. I hear that all the time. Doc, in the last 3-4 months, it's just really, taken an uptick. It's just really intensified, these last 2, 3, 5, 6 months. Okay. Don't wait for that to happen. Procrastination is the thief of health. Okay. So we want to identify this and get out in front of it. Common signs that your neuropathy is getting worse. The symptoms we've already talked about, new symptoms, more symptoms, intensification, trouble at night, sleeping, getting to sleep, waking up throughout the night, slower getting around. These are all things that we don't want to ignore. So a couple just staples about this. There are anywhere from 20 to 24 plus million people in our country suffering with neuropathy on a regular basis. It's becoming more and more prevalent. It's highly progressive. It's what they call it, a degenerative disease, like that train of momentum. Doesn't mean you can't do anything about it. Just means that if we don't work on the cause, it keeps getting worse. And only 35% of neuropathy cases are actually from diabetic neuropathy. A lot of times people think that, well, I don't have diabetes, is this really neuropathy? Well, it's only about 1/3 of neuropathy comes from diabetes. Here's some other big ones. So key into this, guys. Here's a big one. A lot of people, they say, well, I didn't know until your webinar, that was actually the case for me. Cholesterol medications, statin drugs. Okay. One of the biggest drivers of neuropathy. Okay. These statin drugs, other medications for AFib, heart conditions, other chemical toxins and stressors, Agent Orange exposure, chemotherapy. Okay, they call that CIPN, chemotherapy-induced peripheral neuropathy. We work with a number of people with that. Post-infection, we've seen people have an infection, develop neuropathy fairly regularly. Post-surgery, alcohol over years. And then one of the most common is spinal degeneration. Before your brain talks to your feet or to your hands, it sends messages down the spinal cord and then off the nerves in your low back down to your feet, and off the nerves in your lower neck down to your hands and fingers. So if there's a dam in the river, if there's an interference, a kink in the garden hose in the neck and or in the low back, that's an interference between the brain talking to the feet or the hands and then back to the brain, you see? So that's another big one, all right? Okay, falls. It's one of the most important things that we need to avoid with this situation. You can see some of the things that I have written here. 1 in 3 adults over 65 fall every year. 10% are fatal, 20 to 30% moderate to severe injuries. So, when we're working with people, the sensory issues, pain, numbness, tingling, electric shocks, balance issues, big. And then also, so pain, sensory issues, balance. I'm not working, my team's not working to treat those things. We're not looking to treat the symptoms. We're working, as I mentioned earlier, to create the right environment for the nerve tissues to heal so that those symptoms, those issues, challenges are improving because the body's healing. The nerves are starting to heal. Okay, so that's an important thing. It's an important distinction. We're not treating the symptoms. We're working to get the body in a state to heal. Amputation. I just did a, excuse me, I just did a bunch of filming in Los Angeles about 3.5 weeks ago on this whole body of work that we do to tell the story of neuropathy, the industry story, the industry lie, the story of the people that we work with and how we work with them. So I did a significant amount of research on details. And one of the things that we talked about was amputation. In the grand scheme of things, this was one of the things that came up. Easily $20,000 to $40,000 out of pocket, with another $20,000 to $30,000 plus for a prosthetic, then wheelchair and accessibility changes to the house, to the vehicle, ongoing care post amputation. We're talking easily 80,000 plus, 100,000 plus dollars, where the insurance doesn't cover that, the gap, or the insurance doesn't cover out of pocket expense. So, I don't like talking about money, but people, we have these things, people ask questions and, what does this cost? Well, I know what it costs to not handle it correctly financially, but more so quality of life wise. It doesn't matter what we have in the bank account if we don't have our health, what we have in the 401k and retirement and so forth, being debt free, if we don't have our health. So, when people have their health, they have a lot of wishes. When people lose their health, they have one wish. So maybe you've heard that before. I want you to think about that. My opinion, my belief, beyond our faith, the things in this physical world, our health is our greatest asset. Yes, our family, but if our family doesn't have their health, if we don't have our health to serve our family, provide for them, take care of them, enjoy life with them, really the rest doesn't matter. So we need to understand it and we need to work on the cause. None of this Band-Aid stuff, then you're a customer of the system the rest of your life. We're not going to treat the symptoms. We're going to work on cause. Mistake number 2, this is very, very common. It's the hamster wheel approach. Okay. What I mean by that is that, maybe I need to see a neurologist. Maybe I need to see a second or a third or a fourth neurologist for another opinion. Maybe I need, to get this test done or that test done. What happens in the traditional model of care is, you probably have experienced this by this point. Doc, you're preaching to the choir, come on now. I just want to make this point. You go, you get a bunch of testing done, you have neuropathy. Now you have the diagnosis. Comes down to, well, if the symptoms are bad enough, we can give you, gabapentin or Neurontin or Cymbalta or Lyrica or injections, pain management, surgery, whatever. Okay. So maybe we do that. And then what happens, because we're not getting the cause, it typically gets worse, intensifies. Then we raise the dose of the current medication, or add a second or a third or a fourth or, a ninth medication. I've seen all this kind of stuff. Or we go to a different doctor, get more testing done, nerve conduction study, skin biopsy, nerve biopsy, EMG, angiogram, venogram. Well, you have neuropathy. Well, we knew that. Or you have a subtype of neuropathy, small fiber neuropathy, etc. Then what happens? Same drugs, injection, surgery, same approach. Okay. So let's get out of that. If you're a hammer, everything's a nail. Okay. So if you've got drugs, surgery, radiation, injections in your toolbox, and if you don't want that, you need to look somewhere else. So we look and we work from a different toolbox. I'm not saying that there's never a time and a place for those things, but as well as I do that they're not fixing the cause, they're not addressing the root cause of neuropathy. Okay. So we need to look to what we can do to help the body have the environment to heal. Number 3, there's a quick fix to my neuropathy. We know that that's not true. I've just covered these things. So again, gabapentin, also called Neurontin, is an anti-seizure medication, doesn't stop the progression. I would say that 85% of you on the call are taking this or have been prescribed this in the past. Maybe you said yes, maybe you said no to it. Lyrica, very similar approach. Cymbalta, epidurals, tarsal tunnel surgery, compression socks, even things like, other symptomatic treatments that are natural, massage, acupuncture. These things are good in that they're natural. They can help to alleviate some of the symptoms. But are those things in and of themselves going to reverse the condition? No, they're not. It's not that massage is bad or acupuncture is bad or compression socks are bad. I don't think that they are. I think they're actually very valuable. However, let's just be clear, they're not going to reverse the condition on their own. Okay. So we need to have a comprehensive approach. Now, we're about 30 minutes in. We're about to land the plane and wrap up here. So I want you to know that there is hope. I want you to know about this lady right here. Her name's Lillian. Lily, she's a mother, she's a wife, she's a nurse, she's a student. They told her at 52 years old, one of the top neurologists in Philadelphia, that Lily, you have severe neuropathy. You're going to be in 6 months, you're going to be in a wheelchair within 6 months. You're not going to be able to walk at 52 years old. Here's a prescription to see a psychiatrist or a psychologist, because you're probably going to develop depression because you're not going to be able to walk. You're going to be in a wheelchair at 52 years old with 2 kids at home and a husband and, your whole life ahead of you. You're not going to be able to reverse it. Do the best you can to manage it. You're not going to be able to walk, so forth. That's what she was told. 6 months later, and mind you, she's a nurse working, 3 to 4 10-hour shifts per week. She's a student working on a furthering of her degree. She just got a bad review at work because she was so tired and not performing as well on the job. She almost lost her job because she wasn't sleeping at night and she was so fatigued. Fast forward 6 months. We've worked together. 6 months down the road, Lily's walking, no problem. She's sleeping. And again, you can kind of see her eyes there, smiling, describing this, the joy in her heart, describing this. The video, again, is on our websites and our YouTube channel. What she's saying is that I'm able to sleep as long as I want now, 8-10 hours a night. As I'm able to, I can sleep as long as I want. I'm able to work 3 10-hour shifts, no problem. I'm out in my garden again for the first time in 3 years. I can wear my flip-flops, my sandals. I haven't been able to do that in years. I went back down to my neurologist. He couldn't believe it, the look on his face that I had completely turned 180 degrees with my neuropathy within 6 months naturally. So that's possible. Okay. That just, amazing things your body's capable of. There is hope. What's possible for Lily is possible for you. We need to make sure that we're catching it in enough time. Okay. That we're catching it before it's too far down the road. That's the thing that we need to make sure of. This is Mary. I mentioned her earlier, so I'm not going to repeat her story. She's 86. She could walk a minute or two. She can walk 45 minutes now, in her garden for years, going to the gym, on the treadmill, talking to people. She loves talking to people and sharing about her faith. And anyway, so that's Mary's story. So here it is. Guys, just a quick check-in. Type in the chat box. I want you to type yes, the word yes, if you're ready to understand the solution for what we do to help people, how we're going to be able to help you with your neuropathy, what our approach is. It's called our Signature Restore Home Care Program. Type yes in the chat box if you guys want to know how we do that. Okay. All right. Yes. Perfect. Okay, let's do it. All right. Let's hit it. So there's 4 things. Restore the blood flow. Again, not the major blood vessels, the main blood vessels going down the legs. We're talking the tiny networks of blood vessels around the damaged nerve tissues. 2, retrain the damaged nerves how to fire correctly again. Here's a fancy word. It's called neuroplasticity. It means that your nerve system is plastic. It's changeable. It's malleable, changeable based on life experiences. If you drive to church or work or the grocery store the same way for 30 years, you can almost do that drive with not even needing to think about it. It's just second nature because you've done it so many times, right? Boom, it's fired over and over and over and over and over again, those nerve pathways from doing that drive so many times. So neuroplasticity means this: nerves that fire together, wire together. So number 1, get the blood flow back to the damaged areas, reestablish the blood vessel networks. Number 2, retrain the damaged nerves to work correctly again. Number 3, reduce the toxic load and the inflammation. Number 4, have a healthy hormone and blood sugar balance. Do that with time and repetition. Give your body time and repetition to replace damaged nerves and tissues with healthy nerve cells and tissues. That's how healing occurs. Okay. This is a picture of that. You can see the blood vessel networks here wrapped around these nerves. And as the blood vessel supply and oxygen supply decreases, the nerves degenerate all the way to 100% permanent damage. Okay. The train of momentum going from left to right needs to be slowed down, stopped, and reversed. I'll repeat this because it's important and it's one of the biggest mistakes people make. You need the right tools for the job, and you need to do it with enough, you need to do it with enough time and repetition to get that momentum reversed and turned around. So not once or twice per week going to someone's office or 3 times per week going to someone's office, once or twice per day for the first typically 3 to 4 to 6 months, half-hour sessions while you're relaxing, eating, computer, TV, whatever you're doing while you're sitting or laying, you can be getting half-hour sessions in of what we do to reverse this. But it needs, again, your body's a bugger that way. It's going to want to stay the way that it's been. If we're going to change it and get this reversed, we've got to use the right tools with time and repetition. We don't lose 50 pounds in a week and a half. A broken bone doesn't heal in 3 weeks. It takes months, time and repetition. Okay. So the same principles apply if you want to get healing versus just a Band-Aid approach with neuropathy. So here's one of the things: infrared light therapy. There's a lot of different light therapies out there. What we use is the gold standard. The company that we work with is the gold standard. They were the first with FDA clearance for infrared light therapy for neuropathy and wound healing and cellular regeneration, diabetic ulcers, things like that. They have patents on how the lights are arranged so as to get the desired effects. And there's a tremendous amount of research behind all of this. The thing that I have in bold here in the middle of this list says angiogenesis. Let me explain that just for a moment. So angio means blood vessel, genesis to create something new. So your body is literally producing new networks of tiny blood vessels around the damaged nerve tissues. So again, remember I had said, that it's not me who's doing the healing. It's not the equipment that's doing the healing, but we are working to create the right environment for your body to heal and repair itself. If your body wasn't capable of that, we couldn't help you nearly as much. But the fact is that it is. Nitric oxide production is a big thing that helps with blood flow. And also this thing right here called VEGF. If you're taking notes, write that down. When I was doing my filming in Los Angeles, I was researching, as I had mentioned, further, and it's called vasoendothelial growth factor. So it's a growth factor that works with your body when it's stimulated properly to produce new networks of blood vessels. So in my research, I was actually reading, and the Mayo Clinic is doing some significant work with angiogenesis and VEGF, things that we've been doing for years. So very, very powerful. So infrared light therapy, that's part of it to help with that blood vessel supply. Improved balance and reduced fall risk is some of the most significant findings of the research. So, pain and sensation improvements, but also decreased fall risk from improved balance. Nerve re-education. I've already described this, the nerves that fire together, wire together, driving the same way for 30 years to work or to church. You can do it second nature. So what we do with our home regimen is a piece of equipment that's very simple. It is easy to use. It's not big and bulky and cumbersome. It's very simple to use, but the technology is quite advanced. The gentleman who developed this technology over 30 years ago and holds multiple patents on this work, David Phillips, he's a medical doctor. What he's done is basically when your nerves are dysfunctioning, they have an improper or abnormal waveform, like what you see here in blue. It says abnormal waveform. So there's bumps in the road. Instead of it being smooth, there's bumps in the road. That's showing pain. It's showing tingling, numbness, electric shock sensations, burning and freezing. When those things are going on, you don't have a healthy, smooth waveform. It's abnormal, like the blue line. Now, what the technology does is it reads your peripheral nerves, abnormal waveform, and it provides what you see in the green line, the compensatory wave, the equal and opposite counter wave, to retrain or re-educate that nice smooth bell curve. So infrared therapy, time and repetition, the appropriate way, is rebuilding blood vessel networks, oxygen and nutrient supply, better detoxification. The nerve re-education is reteaching or retraining the damaged, broken down nerves how to fire and function correctly again. Excuse me. And then we need to work on the metabolic side of things. Doc, I'm taking some, these nutrients here, these supplements. Excuse me, lipoic acid and B vitamins and, some of these amino acids. That's great. They're important. We use a robust regimen of nutrients as well. It's important. Here's what I'll be clear about is that supplements in and of themselves, a lot of times will help with the symptoms of neuropathy, and they're natural. So that's fantastic. you can get a lot of benefit from that. But to be clear, neuropathy is not going to be reversed, especially if it's been there for some time, just with the use of supplements. You need to have a synergistic approach. You need to have multiple things working together, okay, with time and repetition, which is why we do it as a home care protocol. You don't need to drive to somebody's office 15, 20 times per week to get this done, okay? It can be done at your convenience from the comfort of your home, or if you're traveling, you can do it that way. But we need to, again, have the right tools for the job and use the right amount of time and repetition, okay? Susan, tingling, burning, pins and needles. You can see her video as well. She says, I had my feet hanging off the sides of the bed for years because she couldn't stand to have the sheets touch her feet. In this video, you can see the smile on her face. And I wish I had a picture and or a video of before she started her care, as well as what we have here for the after. She's gotten better and healed, because the night and day, you can literally see a difference in her demeanor, her disposition, her countenance, just, a night and day change. What she's saying here in the video is that it's like waking up on Christmas morning every day, to wake up with my feet still underneath of the covers, be able to get out of bed, put my feet on the ground, my bare feet on the floor, and feel the fibers of the carpet and the coolness of the tile, and not have that sensitive, severe, burning, tingling, pins and needles pain. I love it. I'm not going to beat this horse to death, but some people want to know about research, or they want to know that there is research behind what we're doing. It's robust. I tell people a lot of stories, a lot of testimonials, because people can really relate to that, and I think that that's important. But I also, just like a lot of that the research is important, that we have sound science behind what we're doing. That's all there. I have a bunch of it, but I'm not going to go into, all the into the weeds of all that here tonight. So how can I get help, right? Sounds great. How can we do it? Well, what we need to do is make sure that we have less than 90% sensory loss. I will tell you in full transparency that we help people with more than 90% sensory loss regularly. But oftentimes when we're past 90%, we can still get improvement, but not nearly as much as if we catch it at, 30 or 50 or 70, 80%. You have a lot better chance of getting much more improvement, much quicker than if it's past 90%. So how do we test that? We have a home testing kit. It's very simple. It's not difficult. It's not complicated. We do that. I'll show you how we do that. But anyhow, we get that, our team gets that sent to your home. We walk you through it, either myself or one of my doctors. We do that with you. Tammy, she loves to hike. Her family, they love to walk, hike, be outside, do things together. She wasn't able to do that nearly as well in her early 50s. She's also, for part of what she does for work, she's a bus driver. So, a very important part of her livelihood is being able to feel the gas and the brake pedal, plus all the enjoyment of being outdoors with her family and hiking. Within 4 months, she was significantly improved. She knew the sensation was coming back. Her hiking boots and her shoes were not bothering her nearly as much. Within 6 months, she was walking 2+ miles a day. Again, you can see there 52% sensory function improvement for Tammy within the first 6 months of her care. So, we're not talking years here, but we are talking months, so if you all are on here tonight looking for, I want this better and gone within 3 weeks, probably not going to happen. Sometimes I do see significant improvement within a few weeks, but you need to be more of the mindset of, some months to give your body, again, actually the time and the environment and the repetition to heal the tissues for lasting, sustainable results. It's a process. You know what I mean? Braces, correcting the structure of teeth, losing 40, 50, 60 pounds. You know, the body takes some time to change. That's just a principle. Last one I want to tell you about briefly is Mike. He owns a roofing company. He was having cramping. His toes would curl under. He was having trouble walking, balancing, wearing his closed-toed shoes. He also had a stroke, and his neuropathy that he had before got worse, especially on his left side. He had north of 50% improvement at his 3-month reassessment. So again, you know, we see these things regularly. Lives restored, quality of life, traveling, family, grandchildren, so forth, you know, activities, just life restored. So here's how we work together, okay? So what we do is we do 2 calls. We usually do them over the video. They're not group calls, they're individual, one-on-one. It's either myself and you and or your spouse, family member, whomever you would want on that call or those 2 calls with you, or one of my doctors on our team, where we all collaborate and work together. We all know the systems, the protocols that we use. So it's one of us and you and or your family, spouse, loved ones on 2 calls. The first call, we go over a detailed history of your health, you know, what you've been dealing with, how it's progressed, how it's currently affecting your quality of life, what you've done for it, what's worked, what hasn't worked, a review of, you know, what's going on with your lifestyle and your daily routine. And then we do that home testing kit where Courtney, she's my virtual program coordinator. Maybe some of you have already spoken with her. She'll send a home testing kit out to you, and we'll do a 14-point sensory evaluation. It takes 5 minutes. It's very simple, but it will give us an idea of 0% to 100% nerve damage. How far along are you? Where are we starting? And we can then understand, are you a candidate for the care that we do? Can we help you? As well as what can we expect for improvement over roughly what amount of time? Okay, and then we can do progressive reassessments as we're going throughout your care to make sure that things are improving and healing. So you'll have that home testing kit sent to you. She's also going to send you one of my books, Reversing Neuropathy Naturally. Okay, so we also send everyone one of my books as well. The second call, what did we find? Can we help you? What can we expect for improvement? What are we going to do to help you? What parts of the program are you a candidate for? And how can we create this program of care for you to get the results that you want and have lasting, sustainable results? So my goal, without to go into all the detail of everything, I can't do all of that tonight, but my goal in working with people with our program of care is to have you equipped to get your condition under control, and then to be able to keep it under control with long-term sustainable results without having to then say, okay, you know, 7 months down the way, now what do I do? You know, is it going to stay better? Is it going to come back? You know, what doctor do I need to see now? You know, do I need to, do this medication or these supplements or that injection? No, we work to get you set up, get it handled, keep it handled. Okay. So my goal for you is to identify the root cause of the issue and the severity, what lifestyle factors are coming into play, what are options for you with how we can help you avoid the mistakes that people make all the time. You know, the industry lies that you can't reverse neuropathy. We need to help you avoid that and get you driving as quickly as we can down the path of recovery with this, get you a plan to implement it to get you the results that you need from the comfort of your home. So to work together to see if we can help you, 2 calls, they're, you know, again, give or take 45 minutes each, depending on, you know, the person more or less. 2 calls, the book, the home exam kit, the findings and the recommendations. It's usually $247, $250. We do it for $87. So for all of you on the call tonight, What we have here is the link in the chat box. So we've just posted it. It says, click here to get your neuropathy consultation with Dr. Dan and my team. What you want to do is click on that link. And that link's going to take you to, I'm going to show you here in a second how to take advantage of this. So our normal fee is $247. We still, to this day, we do it for $87 because, again, you know, time and money, you know, they're the two things. You guys have invested time. You know, I think there's more people on the call now than when we started, you know, so not only did you not drop off, more people have stayed on. So I respect that. You guys are taking this seriously. So anyhow, you know, $87 and a little bit of your time, that's the investment. So when you click on that link, click on the link in the chat box. I see a bunch of you guys are already going there. So you're already going there and you're seeing this. Where it's going to take you is to this page for our webinar special. I had promised you in the beginning of our webinar, stay to the end. I have a special offer for you. So there it is. It is $87, 2 45-minute calls, give or take, on the time, the home testing kit, the severity evaluation, the report of findings call. So we can figure out, are you a candidate? How can we help you? If we can't directly help you and work with you, how can we set you up with someone who can help you? Excuse me. So that's what we do. So you fill out your contact information there, your payment information, you pay the $87. Then what happens is it will take you to our schedule. So my schedule, Dr. Kristen's schedule, Dr. Kristen will be doing most of your calls. It'll have a day and a time available that you can pick from that will get on her schedule for you. So again, I'll just walk you through this. You click on the link. So go to the chat box. And in that chat box, you'll see the link, drmcclyman.com/checkout. You click on that guy. It takes you to this page. And this is the page that gets you the discount there. So what's that math? $160, $160 discount. It's $87. So again, you're getting both calls, the home testing kit, the report of findings, how we can help you. We'll discuss your specific case in detail. You fill out your contact information and your payment, you pay the $87. That gets you everything you need there. Good to go. Okay. And then when you do that, it takes you to Dr. Kristen's schedule and or my schedule. You'll see the day and the times. You can pick from what's available there. And then from there, you'll have confirmation of your appointment. Courtney, who I had mentioned is our virtual program coordinator, Courtney will reach out to you. She'll make sure that you're comfortable getting on Zoom call. So again, you know, we can talk with you face-to-face via the video call in a private call, not a group setting. It's private call, one-on-one, or if you have family members with you, that's encouraged as well. So she'll do that, make sure you're good with Zoom. She'll confirm your appointment. She'll get you your test kit and my book sent out to you, and it goes from there. So if anyone needs help beyond what I just explained to you, this is Courtney's number. You're welcome to reach her directly. If you have any issue with getting your appointment set, I know a bunch of you've already gone to the link and gotten booked on our schedule. So that's fantastic. But Courtney's number right here, you can see it on the screen. You're welcome to write that down and reach her. It's 517-896-9909. That's Courtney's number. So 517-896-9909. I'm excited to help you guys. You know, I'll tell you, I just love doing this. You know, I shared with you my grandma. You know, I know that not all of you guys are grandparents. I know that a lot of you are. Some of you are probably great grandparents, and I just love it. You know what I mean? It's a blessing to be able to do something to help people have a greater quality of life and memories with their loved ones, activities, times together with their loved ones. You know, anyway, we really enjoy what we do. I'm excited to help you. What I'm going to do now is I'm going to jump into the chat box and see if there's any questions that came through, and I'll get a few of those answered. One more time, just so you know what to do, click on the link in the chat box, get to the page to check out, and then you'll get to the calendar to get on our schedule. So let me click on this chat box here and see if there's any questions that I missed. Okay. All right, guys, if you do have anything, specific here, let me know. All right, let's see. I got a couple. Does this address severe neuropathy in the hand? Nerve release surgery in lower inner arm didn't help. So it says hand, which makes it sound like it's one-sided. Karen, I do see that. A lot of the times I'll see that after a stroke, or after a surgery, if it's one-sided. Here's the bottom line. The answer to your question is yes, if we're catching it in enough time, and if we can do enough work and enough time and repetition, what we're doing to help is we're working to get the body the building blocks that it needs to heal and repair tissue. So the most realistic way and accurate way that I can answer this is that I don't know how much it's going to help and how quickly that's going to happen with a severe case like this. However, I do know that the best foot that we can put forward, so to speak, is giving your body the environment that it needs to heal and repair. Angiogenesis, blood vessel networks. That's something your body's capable of. When that happens, you have better oxygen supply, better detoxification, and more nutrients. Nerve re-education, the damaged nerves being retrained how to work correctly again. So yes, we do see that, Karen. Okay, and then is it covered by Medicare? What's the cost? That kind of stuff. So guys, listen, let me just go ahead and answer this. It's a good question. Medicare guidelines govern all other private health insurance companies, so some people have Medicare, some people have other stuff, some people have, secondaries and co-insurances and all that stuff. Medicare guidelines, and if you want to write it down, you can see this as well. Just type it in Google. Section 225.13, section 225.13. What it says is any treatment program to prevent deterioration of a chronic condition, which neuropathy is deemed not medically necessary, meaning they don't cover it. So kind of like a hearing aid, the care that we do to help people, and again, should it be considered medically necessary because people do actually get well and they have their lives changed? Yes, it should be, but according to traditional Medicare guidelines, insurance guidelines, it's considered to be because it's a chronic condition, it's considered to be an elective service, kind of like a hearing aid. So insurance does not cover what we do. I do account for that when we work with people. Time and money, they're the two biggest things. We talked a little bit about the cost of neuropathy getting worse, wheelchairs and, assisted living and, amputation, medications, pain management, hospital stays. That stuff's in the tens of thousands of dollars, if not more. The number one cause of bankruptcy is medical debt. So I don't know if you knew that or not. The number one cause of bankruptcy is medical debt mainly because people in our society and our system of healthcare is really a system of crisis management that says, if it ain't broke, don't fix it. If I feel fine, I'm healthy, I'm fine. And if it hurts bad enough, then maybe I'll do something about it. If and only when it hurts bad enough. And typically what we do is something to mask and manage the symptoms, not to get to the cause. So again, if it ain't broke, don't fix it. If I feel fine, I'm healthy. If it hurts bad enough, then maybe I'll eventually do something about it. So we typically judge our health just on, how do I feel? And it's important to feel well. I want you to feel well. That's not lost on me, but I know that we all understand that the top two things, and again, not to be, all dramatic and morbid and over the top here on this webinar, but the top two things that kill people in this country: cancer, heart disease. 5 people out of 6 die of cancer and heart disease. You can have stage 4 cancer and not feel it. I know we know that. And then the first major warning sign of heart disease, 80% of the time, is a heart attack or a stroke. So again, long story short, that's a bit of a long-winded answer to say that we don't allow insurance to dictate somebody's care. It would be nice if insurance paid for everything that was natural and, good organic food from the store and so forth. They don't. They pay what insurance pays for neuropathy is typically testing and doctor's visits, gabapentin, Lyrica, Cymbalta, injections, surgery, amputation, hospital stay, ambulance ride, wheelchair. Insurance pays for that stuff, the stuff that people don't want. So that's my answer for that. I'm looking to see if any other questions came through. I don't think so, guys. I'm excited to help you. If you have any last minute questions, go ahead and pop that in the chat box there. All right, it looks good, guys. Listen, if you're still on the call, I know that you all are serious. I didn't say this earlier tonight, and I usually do on my webinars. I usually say when I'm describing how to book an appointment with us, I tell people, I'm like, listen, if you are serious about getting well, the things that I talked about tonight resonate with you, you want to get to the cause, invest in your quality of life for your future, the future of your family and loved ones, let's get on a call. If you're not serious about getting help, if you are okay with taking medications and just managing symptoms and then, seeing, well, maybe it'll get worse, maybe it won't, then you're not ready for what we do. And I ask you not to book a call. We're here to help you. And I am honored and I would love to help you when you're ready. But if you're okay with a Band-Aid approach, this isn't the right fit for you. If you want to address cause and get to it, jump on the link there, go ahead and get scheduled. You can book that, jump on our schedule, and I'm excited to serve you guys. I'm going to do one more quick check here. Okay, looks good, guys. God bless you all. I'm so excited to help you. I look forward to seeing all of you on our calls, and have a great weekend, and I'll talk to you guys soon. God bless you.